Hey guys, this is Andrew Lee, the health insurance guy, and I just wanted to make this quick video today about why you should work with an agent. Now, I know there's a lot of autonomous people out there that do everything themselves, right? And there's absolutely no issue with that. I have much respect for people that are independent. Now, the only issue with this is how much is too much independence when it comes to understanding the regulations and the workings of Medicare and ACA policies, Affordable Care Act, under 65 policies. So the number one reason as to why you would want to work with an agent is because we're professionals, right? We've been doing this for decades on. So we know this front to back. We have to take a test on this every year, right? So we're up to speed, and obviously we're in the trenches, we're grinding. We listen to we I've heard every single story in the book pretty much, of how clients had a situation, and I definitely had an answer for them. So just that peace of mind knowing that you have a friend that can help you out throughout the process, and that friend has an established team that can also help out, then that's a no-brainer going with a help of an agent. It's free to work. We're free to work with. We don't charge anything, and the only thing that you pay is your premium. So a lot of people are like, well, if I work with an agent, then there's skin off my back. There's none, right? The way we work is we get credit from the carriers. But besides all of that, the most important reason, one the most important reasons as to why we should work with an insurance agent for health insurance is we understand eligibility, right? We understand how subsidies work. Some people that, you know, I have people that reach out to me that thought that they knew how subsidies work and what the ins and outs of, who qualifies and who doesn't. There's a lot of people that initially thought they knew how it worked. And then they come to me and say, hey, I just owed back $4,000 to the government. What gives? Then I'm like, well, you didn't change your income, right? You set up your policy, and then you forgot it, right? You did a set it and forget it. So if you did that, then I mean, I could have told you otherwise, saying, hey, this is how it works with your subsidy. It's actually every single month that you receive subsidies, at a lower, let's say you put your income at a lower amount. If your income was at a higher amount, then you owe back the difference in subsidies. Did anybody tell you that? They're like, no. Should have consulted an agent, right? It's free to work with us. So we know how to evaluate individual circumstances, right? Determining eligibility for ACA policies, any, Medicare policies. We know all of the enrollment periods. We know the special election periods that are happening. We know what plans you can enroll into at a certain time. And, we can explain the eligibility and the criteria as to how you can get into that policy you want instead of being stuck onto a policy you don't, right? So we'll break all that down for you. Now, of course, we assist with the application, and again, I applaud the people who are autonomous, but some people just cannot get through the application. No slight to anybody's cognitive ability or to do anything. I'm not saying that. I'm just saying it's just dang hard. I mean, as somebody that's green, let's say you had employer coverage your whole career, and all of a sudden you're left to your own device to find a health insurance plan. I mean, it's not going to be the easiest search. Let's just be real, because you're used to one system. So please reach out to a broker. It's free to work with us. So I get this all the time, right? I mean, I always get either ACA people that are in that situation, or seniors that just need help through the application process, because sometimes it's not that user friendly, right? And there's a lot of moving parts. So seniors also need to understand what Part A is, what Part B is, what Part C is, what Part D is, the difference between Medicare Advantage, the difference between Medicare supplements, what's a better fit, right? We need to break all of that down, instead of just sort of completing the forms for them. We're walking them through every single situation for whatever question they're asking on the application. So getting assistance with somebody for online and paper enrollments, it's going to be key. And again, it's free to work with us. um, so plan comparisons and selections, right? Now, this is going to specifically have to do with the different plans available in your area, and also what kind of medications you're taking, what medical group is going to be the best fit for you, what medical group your doctor actually is in, and which medical group your other doctor is in. If it's a Medicare supplement, then what features they have in terms of their own respective network, explaining that. That in itself is a whole 20-minute conversation there, right? So full education, because especially with seniors are going to keep Medicare for the rest of their lives, so you might as well, you know, even though it sounds annoying and it's a little bit longer to sort of go into it, I do my due diligence and explain every single scenario and all products available when you're a senior, because they're going to have this for the rest of their lives. It is just realistically what it is, right? So you want to be the person that's going to be the educator and save the day, because that's only going to have a better relationship with your clients, and that's retention for you. So enrollment changes, anything like that, of course we can assist with. And customer service and customer advocacy, right? Who's going to be on the phone with the carriers? Who's going to have your back when Medicare is not answering their phone? Medi-Cal, if you're dual eligible, or Medicaid is not eligible, or sorry, not answering your phone call. I mean, who else are you going to call, right? Your agent. There's a reason why we get paid for what we do, is because they relinquish their customer service essentially to us, so that we can take care of you guys, right? So we are here to help, right? So customer advocacy and support is huge. That's probably the main reason as to why you should actually have an agent, right? We're gonna address any issues with billing, any issues with rate increases, any issues with terminology that you just didn't understand. When when you turn 65, you're pretty healthy, all of a sudden you're now 74 and you're not. I need to explain terminology to you that you wouldn't have understood when you were 64, because you weren't going through said situation. But when you're 74 and you're going through these situations, you need somebody to explain what the heck is happening in terms of your insurance. Your doctor's obviously going to tell you what's happening with your body. So that's going to be our biggest job, is holding your hand through situations like that, right? And we're going to provide ongoing services as we keep going, right? This is not going to stop. I mean, as much guidance as you need, you reach out to us, we got you, right? Now, another thing we do is, we go over cost savings and we go over financial planning as well too, right? It goes hand in hand. I mean, it is technically, we're talking about retirement, we're talking about finances, how much a premium is going to be. Unless you're not a fiduciary, unless you're not talking about annuities or anything like that, we do just talk about cost savings in terms of, okay, this is how much you're going to save on your gym membership. This is how much you're going to save on your groceries, your utilities, whatever the case is. You're even your Part B sometimes. Things like that aren't really advertised, because the advertising out there for, let's say, a Medicare plan is so inundated. You have all those old football players 24/7 on TV. I don't have a TV myself, but when I go to the gym, I see Joe Montana there. I see Jimmy from Good Times. I see Joe, what's his name? Joe Theismann. All the Joes, right? All the Joes are there. So it's a lot, right? So you just want somebody to just tell you what the real is, what the actual situation is, very simply, so that you understand, and you're not in a flurry of, oh, I saw it in a commercial, it must be true. No, let's hear from an agent that takes a test every year, and that is doing this every single day and knows scenarios, because we have clients in that same scenario as well too. So again, we review premiums, costs, deductibles. We explore other government programs and subsidies if need be. We just want to ultimately develop a peace of mind and security for you, right? That's supposed to be the whole Medicare experience, because seniors are the most underserved population, yet you know they're underserved, and yet we're just not there's not enough agents that are capable of helping them at a pretty you know at a pretty good level, right? I mean, there's so many agents out there, but how many are comparable, really? So you'd want to definitely get with a trusted professional guide to walk you through this enrollment process, so that we can have a relationship like that, where you have something where you need to get off your chest, or you have an issue, you give us a call, right? That's why the carriers give us credit, is they're relinquishing their customer service over to us. So again, guys, these are the perks of working with an agent, especially one like myself that has been doing this a very long time with an established team. If you need to reach out to us for anything, for any assistance with health insurance, be it under 65, be it Medicare, feel free to give us a call at 323-844-8471. You can even email me at andrew@healthmutualnetwork.com or info@healthmutualnetwork.com, and I'd be more than happy to walk you through what we just talked about in full detail, if you're needing assistance with that. Hopefully that helped. Hopefully that gave you guys a little more encouragement on Medicare and how ACA works as well. And I will see you guys at the next video. See you soon.